Hello, lovely. Are you alright? You're not doing too good. Alright. I believe you've had a fall, is that right? Okay. So when did the fall happen? Okay. Yesterday. Alright. How did you fall? You slipped on wet flooring, okay? Oh, bless you. What you like? So you've been mopping and went flying. Alright. And you banged the back of your head. Alright. Okay, now. I'm guessing you didn't go to the hospital or the doctor or anything. Okay, we just thought you'd see how you go. That's fair. Alright, so did you have any bleeding or anything? Okay, that's good. Alright, so does the area hurt? It does. Okay. And you have a lump. Alright. A swollen lump and painful. But you don't have any cuts or anything like that. Okay, I will double check though, my lovely. Alright. Okay, so what brings you to the hospital tonight, my love? You're not feeling too good. Alright. What's been happening? Okay, so you keep going dizzy. You feel sick. You have a headache. Okay. And just not quite right. Alright. Well, you've done the right thing by coming in, my love. Alright. I'm here to see what's happening and help you, okay? Alright. So, when you fell, my love, did you pass out or anything like that? No, but it really hurt. Okay. Alright, and then you felt a bit sick, but it passed. Okay. Alright. Have you been having any double vision, blurriness? Okay. How's your memory? You doing alright, or have you got any gaps in your memory or anything like that? Okay, so things feel a bit fuzzy. Okay, fuzzy. Alright, and disorientated. Okay, that's fine. So would you say you've been a little bit confused? A little bit off balance? Okay. Okay, alright. So, it sounds like you've got a little bit of concussion, my love. Alright, yeah, nothing too serious. Okay, but it's not very pleasant. And you've done the right thing because you do need to be monitored. Okay. So I'm just going to observe you if that's okay. So you just sit there as you would. Okay, and I'm just going to see what's happening. Alright. Okay. So. Now, I know it's quite bright in here. Is it too much? Okay, so you are quite sensitive to the light. Alright. Okay. And what about sound? A little bit, okay. Alright. Your eyes are quite watery. Yeah, a little bit bloodshot as well, my love. Okay. Now, have you been sick at all? Okay, so last night. Okay. And then this morning. Okay. It's mostly nausea. Alright, well, you are responsive, so that's good. Alright, and you are alert, even though you are a little bit, disorientated and a bit confused, but, you are awake, so that's good. Alright. Now, would you say since the fall, you've just started to feel worse and worse? Okay, so it's not getting any better. Alright, that's concerning though, my lovely. Alright. So I'm glad you told me that. Okay, but I don't want you to worry. Okay, I'm here to help you and look after you. Alright. Okay. So, now I'm just going to watch you blink, if that's okay. Just relax, and I'm just going to monitor your eye movements and that. Okay. Okay. Are you tired? Yeah. Have you had much sleep? A little bit. Okay. Okay, so you are blinking okay. It's probably a little bit on the slow side, and your pupils are looking a little bit on the large side, okay. Alright. So I'm going to check your pulse and oxygen levels, okay? So if I can have your index finger, that finger, there we go. Alright. Just relax it there for me, okay, my lovely? Alright. The floors, yeah, they're slippy, aren't they? Doing your housework and, oh dear. That's it, just relax for me, don't speak, my love, now, okay? I'm just going to monitor that. Your oxygen levels are nice and high, which is good. Alright, pulse is quite elevated, alright, but understandable in the circumstances. Okay, it's not alarming, so don't need to worry, but obviously it is on the higher end. Okay, alright, okay, I'll take that from you. Okay, so we had 97 oxygen, 2 okay. Alright. Okay. I'm going to check your temperature. Alright, so I'm going to pop it in your ears and put it on your forehead. Okay, so pop it on your forehead first, if that's okay. Okay, it's a little bit on the high side. Let me just pop it in. Okay. The other. Okay, temperature is slightly high, my love. Alright. Nothing too drastic, okay. Could be why you are feeling a little bit, nauseous and hot, my lovely, okay. Sometimes when we have concussion, we can get a mini fever, alright. So that's all that will be, my love, okay. I'm not concerned because it's only slightly elevated. Okay. Right, so just going to get my light. Okay, now I know this is not going to be very pleasant, but I need to have a look in your eyes, okay? Alright. So, if you can just try as best as you can to just keep looking straight ahead for me, okay? Thank you. If it does get too much, let me know. Okay. Alright, my lovely. You're doing well. Good. Okay. 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 All right. Your pupils are reacting, but a little bit slower than they should be, my lovely. All right. Again, very normal with a concussion. Pop some gloves on in a moment. I need to have a feel around your head and that, but I want to check your blood pressure, okay? Okay. I could have this on. Okay. Alright, my lovely, you're doing really well, okay? I know. Okay, I'm going to put that about there. And I'll go around. Okay, now this will go really tight, okay? Okay. Okay. And I'll check it again. pressure was a little bit high on the first go, but on the second one it come back down all right. It's usually the way sometimes, especially when you've got a little bit of anxiety or something like that. Okay. Alright, okay. Now. Now I'm going to have to get you to do a few little things if that's okay, my lovely. Alright, so as best as you can, if you could look at my finger. Alright, and just with your eyes, if you can follow it, okay? Okay, I'm going to go a little bit faster now. Good try, my love. Your eyes were going out of focus quite a lot, okay? I'm struggling to keep up. Alright. Okay, so we can do the same again, but with my light. Alright, so look at my light and just with your eyes, follow it. That's it, just with your eyes. Good job. Okay, let's bring that back in. Alright, do as best as you can, my love. Okay. Struggling with the light, aren't you, to focus on it, follow it, probably because it is bright and I can see you getting quite confused and disorientated with that, my lovely, okay? Okay. Now, I want you to look at my nose, okay? Alright, keep looking there. Tell me when you can see a finger, okay? Good try. Okay. Alright. You sure? Okay. Keep looking at my nose. Alright. Tell me when you can see my finger move, okay? Alright, okay. Keep looking at my nose. Alright. I want you to tell me when you can't see my fingers anymore, okay? So look at my nose. Okay, so focus back at my nose, my lovely. Alright, okay, so not my fingers, my nose, yeah? Tell me when you can't see them. Okay. Okay. Now keep looking at my nose. Tell me when you can see my fingers, okay? Okay, alright, good try. You want to stop a moment? Okay, my love. Okay. Okay. Now I'm going to say some words and I would like you to repeat them. Okay, you ready? Apple, apple. Good. Chair, chair. Pink, pink. Okay. Now, can you count from 1 to 10? And can you count from 10 to 1? Okay. Good try, my lovely. And can you repeat after me? A, B, C. And can you say it backwards? Okay, you're a little bit confused, aren't you, my lovely? Alright, not to worry. Okay, it's fine. Do you remember those 3 words I told you to repeat? Not the letters, the words. Okay, would you like me to repeat them? Apple, chair, and pink. Okay, not to worry. So, alright. Okay, I want you to, with your finger, to touch my finger and then touch your nose. Okay, so I'm going to go finger, nose. Okay, finger, nose, 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 finger, nose. Alright, my lovely. Struggling with these tasks, aren't you? Yeah. You must have really hit your head hard. Alright. Okay. Now, my 2 fingers, if you would just grip them with your hand. Okay, can you squeeze? And more. Okay, and the other one, grab, squeeze, and can you do more? Okay, thank you. You're quite weak, yeah? Okay. Give me your hands. Okay. Okay, squeeze. Any harder than that, my love? Okay, release then. And squeeze. Can you try any harder? Alright, don't worry. Okay, my lovely. Good try. Alright. Do you remember those 3 words? Okay. Right. Okay. Okay, what I want you to do now, if you can, I want you to gently move your head down to your chest, okay? Tell me if you feel any pain, discomfort, or any weird sensations. Okay, and back up. Now carefully pop your head back as far as you can. Alright, steady. Okay, and back. Alright, making you feel a bit dizzy. Yeah, okay. Do you want me to wait a moment? Okay. Alright, now turn your head that way but slowly. Back at me and then slowly that way. And back at me. Okay. So your movement is okay, but that is making you obviously dizzy, so dizzy, nauseous. Okay. Okay. I'm going to put my gloves on, okay? And what I'm going to do is have a feel around and have a look at your lump. Okay. Okay, am I alright if I touch your face and your head? Okay. So I'm just going to feel the face first. Okay. Okay, so whereabouts is the bump, my lovely? Okay. Ooh, all right. That is very, very swollen, my lovely. Sore. Okay. There's definitely no cut, but there's a lot of inflammation and bruising, okay? So tell me, does it hurt here? 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 There. Okay, anywhere else? Okay. Let me know if there's any pain anywhere else, my lovely, okay? Okay, alright. Okay. So, as I said, we have lots of inflammation, lots of swelling, okay, redness, no cuts, okay. Okay, so I can see the lump, all right, that's where, you know, the impact was, and it's quite large, so it's kind of like this, and I'm guessing you hit more the centre, and then the round it is actually swollen, all right. Yeah, and in turn you've got a lot of pain outside of the lump as well, okay, which is concerning me, my lovely. All right, so you definitely do have a concussion, and it's quite a moderate concussion to severe, all right. And I need you to go and have a scan on your brain just to be sure, all right, and make sure that we've got no internal bleeding or any damage. All right, it's just something I do, all right, when patients are showing signs like yourself, all right, and one especially with a large lump on their head or a large surface area of pain and discomfort. All right, so you meet all those criterias, so I will be getting you for a scan, and I will be keeping you in, my lovely. All right, and I know that sounds scary, but please don't be scared, all right. I'm on duty all the way through the night, and I've got some wonderful nurses on tonight as well to look after you. All right, my lovely, so you're in perfectly safe hands. You're in the best place, to be honest with you, because we can monitor you, keep an eye on you. Okay, so you will be staying in overnight at least, and you will be going for a full MRI scan. Okay, now we need to keep you hydrated as much as possible, my lovely. All right, so we need to make sure you are drinking plenty of water, but not guzzling it. Okay, you will be admitted to the ward as well, my love. Okay, so we need to get plenty of rest. Okay, we need to avoid bright lights and screens and things like that. Okay. 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 Right, so the plan is I am going to get you admitted to the ward now. All right, and I can do that right here with you. All right, my little special trolley and everything. So let me just get that in there. Okay. So let me take these off. Right, so okay. Can you recall your full name and your date of birth? Thank you. And do you know which hospital you're at, my love? Okay. Okay, so you are going to be going to stay here. Okay, wonderful. They are going to now sort out your bed. Okay. Wonderful. So that is that. Okay. So emitted on the system anyway, and I need to get you your band. Okay. So okay, lovely. Okay, so the plan is, in a moment, you'll be taken over to your bed. All right, you're going to get yourself nice and comfortable. I'm going to get you in a gown, you're going to relax, and you're going to get as much sleep as you can. All right, you will be checked regularly, your pulse, oxygen levels, and your blood pressure and your temperature. All right, my lovely, and you will be given some pain relief and some anti-inflammatory. All right, I will also be popping you on a drip just to keep you hydrated. All right, as much as possible. Okay, my lovely. As I said, we'll be keeping an eye on you. Then you will be needing to go for an MRI scan, but that probably won't be till the morning now. All right, so you're just going to get some nice rest, and then you're going to have an MRI, and we're going to check all that out and see what's what. But, you know, we will be treating you for concussion, my lovely, all right? So any medication and things that you need to have, we will be giving you today. All right, so you haven't got to worry about that. The night nurses will sort all of your medication out and things that you need to be taking for the night, so you haven't got to worry about any of that. Okay. So that'll be that. That's that done. And then what may have to happen then is, depending on your scan results, on whether you will need to stay in again and go from there. All right, they may want to check your cranial nerves, but you know, we'll see what's what. So at the moment, I'm happy with everything and with what's going on. I've got a plan going forward. I will let all my colleagues know, and then we can go from there and get you better, my lovely. All right, so do you have any questions for me? Okay, you just want to go to sleep. All right, it's understandable. Okay, let me just page through. Okay, so I've got somebody to come and get you. All right, let me just check the system. Okay, your bed's actually ready now, my lovely, so you can go over. Okay, just see. Okay, James the porter is on his way. All right, I will be coming to see you in a little while as well, don't worry. Okay, so James will take you over to your bed. Okay, then I think it's Jan tonight at the moment. I think Jan's on. Jan will come and get you your gown, get you nice and comfy, get your medication, get you your drip, and you know, she'll get you into bed nicely, make you nice and comfortable. All right, and then she'll check your obs again. All right, and then she will dim the lights and let you get some sleep. All right, and then as I said, she'll be in and out. Then in a few hours, I'm going to come and check on you and make sure you are doing all right. Okay, all right, you're very welcome. All right, James. Yeah, they are ready to go to Bay 3. Yeah, all right, thank you very much. Yeah, if you could help them over and take this with you, that'd be fantastic. All right, and if you just let Jan know as well and say that I'll be around in a couple of hours. All right, I'll just pop that there. She'll get her to read that for me. Okay, wonderful. Okay, thank you very much. Right, I'll leave you with James now. All right, and he will take you over to Jan and get you settled in Bay 3. All right, my lovely. Okay. All right. Not to worry. Okay, get some rest now and just chill out and let us look after you. All right. You're very, very welcome, my lovely. All right. Now you get some rest. Okay. You take care now. Bye bye.